Hello everybody and welcome to the protocol for the $1 Million Facial. My name's Kate, I'm the Senior Educator and Business Support, and this is Anne-Marie, the Training Manager.
Hi everyone.
Today we're going to take you through step by step the $1 Million Facial, taking you through the do's and don'ts to help you along the way with your treatments. So we're going to get started first of all with really important to wear your apron. We're going to wear a mask and the gloves as well.
Okay, so we've had a consultation with our client. We've got everything ready, all of our products, everything's prepped. So we're doing the two tray method. So we have all of our skincare products on the top tray. We've got our water, we've got our globes, our expanding towelettes, our dermaplane hand tool, blades and sharps box. And then on our second tray, we've got all of our disposables. So we've got our microneedling roller, we've got our mask brush and our disposable products ready as well for the end of the treatment.
So the first step is our double cleanse. So we're going to pre-cleanse first of all with our $1 Million Cleanser.
Yeah, so we're going to pre-cleanse to remove any makeup so we can do a full skin analysis.
So what have we got inside this cleanser?
So for this cleanser, it's a nice, soothing, nourishing cleanser. It has vitamin E, glycerin, aloe vera, so lots of nourishing products in there as well, and the papaya fruit extracts to gently exfoliate the skin. So we're going to do a pre-cleanse. And then Kate's going to have a little look at our client's skin just to see whether or not she's suitable for having the $1 Million Facial. It's really important to do that skin analysis and discuss your client's expectations and to check as well if they can have the treatment. So if our client was to have any congestion, pustules, her skin was quite oily, then she wouldn't be a suitable candidate for the treatment. She would need to go down the route of having a mini $1 Million Facial or one of our super facials. Maybe you might recommend a course of peels. So we need to prep the skin, make sure that it's ready for the $1 Million Facial. We can't just bring any client in and give them a $1 Million Facial just because they want to have it done. We need to decide whether they are the right client for the treatment. Okay, so we're going to do a skin analysis. So we're going to have a look at the client's skin to see whether or not she is suitable for having a $1 Million Facial. If we look at the client's skin and the client's skin is overly oily, if she's got a lot of pustules, if her skin's quite congested, then she wouldn't be suitable for having that treatment. So then we would need to opt for one of the other treatments, which is the mini $1 Million Facial or one of the super facials. So we're going to have a little look now. We have discussed the client's targets. So she would like to improve the overall appearance of her skin in terms of texture, tone. She has some sun damage there, but she is using her SPF at home as part of her home care routine, which is very important. So if your client's not using the correct home care products, you do your skin analysis and they're not suitable on the day, then you would need to go for another treatment. So Kate, if you could just have a little look at Emma's skin now, and we'll just have a little look at what we can see. So we can see Emma has quite sensitive skin around her chin area and a little bit of sensitivity on her forehead as well.
You can see just a mole here on the cheek, so I need to avoid.
Yeah, so we've got a couple of raised moles which we're going to need to avoid. But overall, you know, there's no concerns where we cannot perform the treatment.
There is a few terminal hairs on the chin there.
Yeah, okay. So for terminal hairs, they would either need to be plucked on the day of the treatment. They can be threaded as well if you do threading, or it would be 7 days before or 7 days after for your waxing.
Perfect. So once we've done the skin analysis, we're going to go on to our second cleanse.
Yep. So we need to do a deep cleanse now, so we know that the client is suitable for having the treatment, so we can go on. So the deep cleanse is going to remove any excess makeup, any impurities from the skin. It's going to help to relax the client as well.
What would you recommend if the client likes this cleanser within the treatment? Is there an equivalent for the home care?
Yeah, so it's always good to ask the client at the end of the treatment if they did like any of the products that you've used, and then you can link sell them as well. So the Derma Cleanse, that would be the recommended cleanser, which is very similar to the $1 Million Professional Cleanse.
And they can use that every morning and evening to clean the skin?
Yeah, they can use that morning and evening. If they had a more oilier skin type, then they could use that as their first cleanse, and then they could use the Glyco Wash as well. Or they could use the Glyco Wash, like say 3 times a week.
So once we've done our double cleanse, we're going to go on to our potion.
Yep.
So what's the potion?
So the potion is going to remove any excess cleanser. It's all going to also soothe and hydrate the skin. So with your $1 Million Professional Potion, you've got your vitamin E, so it's very nourishing. Then you've got your yeast extract, and you've also got your rose floral water as well. So that's going to help to remove any cleanser. It's also going to help to make sure the skin is all clean, prepped, ready. It's also got antibacterial properties, so that is good to do before you start your dermaplaning.
Perfect. And that's the next step?
Yes. So we're going to go on to do our dermaplaning now. So we're going to apply our balm if needed. So if the client's got dry skin, then you can use your balm. If the client's got an oilier skin type, then you wouldn't need to use any of the balm. Now you just need a small amount on the back of your glove, and you can take it as and when you need to. So you apply it into a section, and then you can do your dermaplaning in that area. So I wouldn't advise applying it to the whole face, as your gloves can become quite slippy and it's harder to get your stretch in certain areas then. So just apply it to the area where you're going to be working. That would be a top tip of mine.
So to apply the blade to the applicator,
yep.
So we're going to hold it flat, and you want the groove, so make sure it's facing the same way. If not, turn your blade over.
Yep.
You're going to come up underneath till you hear that click.
Okay, so I do advise to always work in sections. So always have an idea of where you're going to start and where you're going to finish. So for some clients or some technicians, they might prefer to do one side of the face and then do the other side of the face. Or you can start at one brow and then just work your way around and come back up to that starting point. Then finish with the chin, lip and nose. But it's preference, and how do you prefer to do your treatment?
So I like to start on the forehead,
yep,
and work down one side of the face, across the chin, back up the other side, and then do the top lip and the nose after.
Yeah, okay, and that is fine. So any way in which you feel better for you is fine. You just need to make sure that you do have that plan in mind, so you're always working in those sections. So we're going to go onto the forehead now with our blade. So when you're holding your hand tool, the correct way to do this is by using that circular mark on the hand tool as a guide to where your thumb should be. Placing it across your fingers and then coming onto the forehead. Yeah, that's right. So always having your stretch with your finger and your thumb. Okay, so we're going to always be working within that stretch. So you're going to go onto the skin and you're going to be working back and forth with a nice 45-degree angle. That way you will remove more vellus hair and dead skin cells than you would if your angle was flat or if it was too raised. So if your angle was quite flat, you wouldn't see anything coming off at all. If it was quite high, then you're going to hear that scratching sound, and it's going to be a little bit uncomfortable for the client. Okay, so as you can see, Kate is gliding back and forth, and then she's just placing her vellus hair and dead skin cells onto the cotton wool pad next to the client's. So what you don't want to do when you're dermaplaning is be twisting your body about. So you do need to get up and work around the bed as well to find a position which is safe and comfortable for yourself.
What do I do if I can't get the blade in between the eyebrow and the hairline?
Okay, so what you could do is you could stand up and come round to the side,
yep, and
then you can work from the hairline to the end of the brow this way.
So I can do it this side?
Yeah, you can do it that side as well.
Perfect.
And then making sure as well that your stretch is small enough to keep the skin taut. So it's not too far apart, because once your stretch is too long, then you no longer have that stretch there and the skin will move about, and then that's when you're more likely to nip or cut the client. Okay, so the right definition videos are all in the file section in the Dropbox, and that shows you they're really good informative videos, and they do close-in shots of the dermaplaning treatment being done as well, so the right technique and the right angles, how to hold your hand tool. They're very good informative videos, so they may help you if you are struggling with your angle or with the hold of the hand tool. So dermaplaning is going to remove 3 to 4 weeks worth of dead skin cells in one session, so you're going to get a really good exfoliation. Also, it's going to help with fine lines and wrinkles. It's going to help with the penetration of your product, so you're going to absorb a lot more of the product at home, as well as the in-house treatment as well. So you're going to absorb 80% more of the product as opposed to the 8 to 10% if you hadn't had that exfoliation done. So it would need to be every 4 weeks. So you need to let the skin go through that natural healing cycle, which is between 28 to 36 days. So you need to let the skin go through that cycle before you can complete another dermaplaning treatment. One of the main questions that you do get asked with dermaplaning is, will the hair grow back thicker and darker? And the answer is no. So we are only removing the vellus hair, and it's physiologically impossible for that to grow back any different. The only areas in which you will develop terminal hair due to things like hormones would be around the chin area or the top lip. And that can be as you're coming up into your 30s or after pregnancy. Your hormone levels can change, so you may have more testosterone hormones, so that would then cause those terminal hairs, and polycystic ovaries as well. You may get more terminal hairs on the face. So with that client, you would need to manage their expectations. So it's not always ideal for somebody who does suffer with polycystic ovaries to have the treatment, because they're going to have a lot more terminal hair. So if it's for that reason that they're wanting the treatment, then I wouldn't advise it.
So on the nose, you need to still work between your thumb and index finger?
Yes, so it's better to turn the client's head slightly to the side and then just tilt your hand tool up,
Higher.
And then you're just going to be doing small back and forth movements, just gently working softly on the nose.
And then how do we do the bridge of the nose?
So just gently again, just coming up the bridge of the nose.
Flat
with
blade?
Yeah. Okay, so now we're going to show you how to remove your blade safely. Okay, so you're going to take your blue box. Now you can see on the hand tool, there is a full video demonstration of this as well in the Dropbox. So you can see on your hand tool, one side is thicker than the other, and that fits perfectly into the cutout square in your blue box. So you just pop that in, put pressure on the lid and pressure on the hand tool down. So you're not pulling it out or bending it down, you're just literally putting pressure on the hand tool, pressure on the lid, and pull straight out. Like that.
So once we've finished the dermaplaning, we're going to go on to applying the serum, and then we're going to use the ice globes for a nice relaxing lymphatic massage. So how much serum do we need?
So you only need around 2 to 3 pumps of your serum.
And why do we apply the serum before we use the globes?
So the benefits of applying the serum are, a serum is very good for nourishing the skin, hydrating. It's good for scarring as well. So it's going to help with the glide of the globes. The globes are going to glide easily across the face with the serum, as without the globes you would not get that glide.
Okay, so we're setting on the forehead.
Yeah.
And then we're going to drain out.
Yeah, so you're going to work out towards your lymph nodes. So you're going to go to your parotid nodes, then we're going to go down to your supraclavicular nodes. Then you have your deep cervical nodes down here. So we're just going to be working out towards those.
Perfect. So we're going to stimulate lymphatic flow.
Yes.
To help to drain away the fluid and the toxins. Increase circulation, or is this kind of more relaxing?
Yeah, so it's a very relaxing part of the treatment because that's why we say science meets indulgence.
Okay.
So we've got the science-backed treatment, such as your microneedling, your dermaplaning, and then we've got the luxury part of the treatment where you're going to be doing that nice, relaxing lymphatic drainage massage.
Can you do the $1 million facial without the globes if you don't have the ice globes?
Yeah, of course. So you can do the lymphatic drainage massage just using your fingers, so 2 fingers, just working out towards those lymph nodes. And I mean, you can do it both as well. So you could do it manually and then do with the globes. And there's a step-by-step guide to the lymphatic drainage massage in the manual. Okay, so now we're going to go on to do the microneedling part of the treatment. So during your $1 million facial treatment, we're going to be doing 2 passes, 3 by 3. But before we start that, we've made sure that we have put the lot and expiry number onto the consultation form, which is really important. Your rollers are fully sterile and you can get those on the website at £10 each for platinum technicians.
Okay, so I'm going to start on the forehead. We're going to work round.
So again, making sure that you're working in sections. You've got a nice controlled method. So you're working back and forth. So you're going to go 1, 2, 3, and then across. 1, 2, 3. Okay, so your pressure should be enough to see some erythema happening on the skin. So you're going to see that redness, but you're not going to be seeing any pinpoint bleeding. So with a 0.5, all you should see is that erythema happening on the skin. Yes, if you are treating acne scarring, you are going up higher in needle depth. So maybe you're working at a 1 or a 1.5, then you will see some pinpoint bleeding in some certain areas. Okay, so you can see Kate is working in a very controlled way. So she's working in sections, working back and forth and repeating that by lifting off the roller and then placing it back down. So you should never glide across the skin. You should never put so much pressure that your client is extremely uncomfortable at any point during the treatment. It's not the most pleasant feeling while you're having the microneedling done, but you know, it shouldn't be so uncomfortable that the client wants to stop the treatment.
So when would you go over the face 6 by 6?
6 by 6 would be your standalone $1 million microneedling treatment. That client may have acne scarring, so you're going to be treating the scarring, or deeper lines and wrinkles, or they might not be suitable for having the dermaplaning part of the treatment, so they would opt for the $1 million microneedling. Microneedling stimulates the collagen within the skin, so we're creating micro wounds in the skin, which is going to create that healing process. So we're going to go through the stages now of the wound healing. So we're creating those micro puncture wounds in the skin, which is going to create that inflammatory phase, which is going to last for around 3 to 5 days. And then just overlapping that is the profilative stage, which is going to last around 3 to 21 days. Then ongoing from that is the remodeling phase, where the fetal collagen, is going to turn into that stronger, denser type collagen. So that is going to be the remodeling phase, which is going to be around 21 days to 2 years. So collagen does deplete over time as we age, from as early as our 20s. So we do need to come back in for maintenance treatments as well to help and support that collagen. So for microneedling, you can come back after 2 weeks and have a standalone $1 million microneedling session using a 0.5. Then if you wanted to have a $1 million facial again, then you would need to leave it 4 weeks because you've had that dermaplaning treatment as part of your $1 million facial. So it's 4 weeks for your next $1 million facial, or you can come back in 2 weeks and have a session of $1 million microneedling using your 0.5. Okay.
So just talking about the top lip, how do you do the top lip? If they've got, obviously here we've got quite a space, but if they've only got a little gap?
Yeah, so you can use the end of the roller, so just gently gliding back and forth, or you can do like a stamping technique. If there's a very small area to work on, you can just hold your roller up slightly.
Yeah.
And then just go down and then just 1, 2, 3, 1, 2, 3. So you're still working on that area. And that is better and it's safer as well for the client if you're doing that, if they haven't got much room on that top lip.
So I've done one full pass.
Yes.
And then I go again, the whole face,
Yep.
one
So
more time.
another full pass now, so 3 by 3, just checking with the client as well that they're happy for you to complete that second pass. So making sure that the client is comfortable at this point, you know, having a little look at the skin. Has the client's skin gone extremely red? You know, have they got any redness there at all? So that's what you're assessing now before you do your second pass.
Perfect.
Okay, so we are ready to apply our mask now. So we have our pre-prepared products down on our second tray. So we've got our mask, SPF, we've got our balm and our eye-tox. Then we've also got our yellow bag. So anything that touches the skin from the point of microneedling needs to be disposed into your clinical waste. Okay, so Kate is just applying the mask now to the skin. So you can see the skin is absorbing that mask in. So you are going to absorb a lot more of the product because you have done the dermaplaning and the microneedling pre-mask. So the mask contains hyaluronic acid, so it's highly hydrating for the skin. It's a humectant which holds 1,000 times its weight in water. It also contains glycolic acid, aloe vera. So it's very hydrating and soothing for the skin as well. So it may calm any redness.
How long do we leave the mask on for?
So you're going to leave the mask on for around about 5 to 10 minutes. Okay, so our mask has been on now for around 5 minutes, and you can see that the skin has absorbed a lot of that mask. So we're going to remove the mask now with your expanding towelettes.
Is there any tingling sensation with the mask?
So your client may experience some tingling with the mask on. That is due to the small percentage of glycolic acid in the mask. Okay, so that's the mask removed now with our expanding towelettes. Now we are going to apply some balm.
So we're going to apply the balm to the whole face?
Yeah, so we're going to apply the balm to the face. Emma has quite dry skin, so that's the reason why we're using the balm. So the balm is very nourishing and very hydrating. It's very soothing on the skin as well. Once applied, it should calm the skin. It should remove any tingling. It's got calendula oil, shea butter, so very good for healing.
Can you apply the serum instead if they are a little bit more of an oily skin?
Yeah, so you can apply the serum before your SPF, as opposed to the balm if your client's got an oily skin type. Now we're going to apply a small amount of eye-tox. So the eye-tox is really going to help soften those fine lines and wrinkles around the eye area. It's very nourishing and hydrating for the skin. So it contains hexapeptide 8, lactic acid, citric acid, papaya fruit extract, vitamin E as well. So it's very nourishing for around that area.
And then the final product is the SPF 50.
Okay, so we have our broad spectrum SPF, which is going to protect the client's skin from the UVA and UVB rays. Okay, so we do need to make sure that every client leaves with SPF on, and they need to be using it at home before, during and after their $1 million facial treatments. Okay, so now Kate is going to dispose of any products or any cotton wool pads, Bedroll into the clinical waste. So now we have completed the $1 million facial treatment, we're going to have a little chat with the client, discuss her expectations and what treatment we're going to do next. Then also we're going to ask the client, did she like any of the products that we've used today, which we can then recommend our MediPlus retail range. So if she liked the cleanser, we can offer our Derma Cleanse. If she liked the serum, for instance, we can offer our Hydrating Elixir Serum as part of the Medi range. We've also got our MediPlus Shield 50, which your client can use daily, so they need to be using that SPF if they're wanting to have these types of treatments to protect their skin. Okay, so then we've got your eye-tox, we've got your balm, so all of these products that you're using as your professional range, we have within the Medi. So you can retail those products onto the clients, so they can support your in-house treatments with the home care range. Okay, so that's the end of our $1 million demonstration. The $1 million is just one of 10 protocols, so there are many treatments that you can offer your client if your client is not suitable to have this treatment. Everything that we've covered is in the Dropbox, in the file section of the group, so you've got all your videos on how to do the right technique for your dermaplaning, your microneedling. All 10 protocol videos are in there as well, so if there's anything you need, you should find it within that Dropbox.